Hello, good morning everybody. I am Dr. Mohammad Fawad Ali, consultant physician and diabetes specialist at Udai Omni Hospitals, Hyderabad. Today we are going to speak how diabetes impacts sportspersons and athletes in their daily life. As a physician, I've encountered many patients who wants to pursue active sports but they are diagnosed with diabetes. Most commonly it is type 1 diabetes and they want to pursue sports. So these kind of patients needs encouragement from the family, from the fraternity and from the physicians as well, because the benefits of sports outweigh the risk of diabetes. We have to understand what is diabetes. Diabetes is basically of two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes is autoimmune, where there is decreased insulin production because of beta cell destruction, and type 2 diabetes is usually seen in middle age and older patients because of decreased insulin resistance and inability of the body to use insulin owing to obesity, sedentary lifestyle and many other risk factors. So the most common type of diabetes seen in sports persons is type 1 diabetes, and for that we have to understand how the insulin works and how this blood glucose is utilized in the body. Whatever we eat is converted into glucose in the body, and which needs insulin for its utilization into the cells and for energy production. So in type 1 diabetes there is decreased insulin secretion, and that leads to hyperglycemia and its associated symptoms that can be increased urination, increased thirst, fatigue, lethargy, confusion and many other factors. We have to understand that as an active sports person, type 1 diabetes carries a risk of both hypoglycemia, that is decreased sugar levels, and hyperglycemia, that is increased sugar levels. Hyperglycemia can occur because of increased insulin dosages, because of exercise and because of skipping meals and eating less of carbohydrates, whereas hyperglycemia can occur in many types of exercises. There are basically two types of exercises: aerobic exercise and anaerobic exercise. In aerobic exercise there is hyperglycemia. Aerobic exercise, examples of aerobic exercises can be walking, cycling, running, playing cricket, football, etc., which utilizes oxidative pathway, and there is a decrease in the sugar levels that is seen in this aerobic exercises, whereas anaerobic exercises are short exercises like weightlifting, sprinting, that can cause hyperglycemia. So the foremost important thing while advising the athletes before embarking on their sporting journey or pursuing active sports is to understand the disease better. The sports person should take ownership of the disease and should be counseled by the physicians and the diabetes counselors regarding the disease, regarding the symptoms, identifying the risk factors, identifying the complications and addressing them as soon as possible. So as a sports person, he needs to be well informed regarding his disease and the complications it can cause. So with the proper guidance of his physician, with the proper guidance of his mentors and nutritionists, a type 1 diabetic patient can be a very good sports star. We have a lot of examples like Wasim Akram, the bowler of the previous generation, is a type 1 diabetic patient. Jay Cutler is a famous American football player. He is also a type 1 diabetes patient, but in spite of the disease, they have excelled in their sports. So the most common causes of hypoglycemia, as I have told you, is decreased carbohydrate intake, increased insulin dosages, and not able to identify the symptoms of hyperglycemia. The most common symptoms of hypoglycemia seen in athletes are sweating, confusion, lethargy, lack of coordination, and if it extreme, the patient can become unconscious and go into coma. And the signs of hyperglycemia is excessive urination, excessive thirst, and increased breathing rate. So the athlete should be trained to understand the complications that can arise because of the disease. And regarding the medications, the proper medication should be devised by explaining the patient regarding his disease and also telling him how to take his medicines on time and how to identify the potential complications. The most common type of diabetes, as I have told you, is type 1 diabetes in athletes and sports persons. They need continuous insulin. For that, the insulin regimen should be planned in such a way that it should not interfere with his daily training habits and it should not cause him hyperglycemia as well. So any person who is going for aerobic exercises like active football player, cricket, sprinters and all those persons who have to exercise for more than an hour or more than 45 minutes maybe, they should at least consume a little bit of carbohydrate rich diet before starting exercise, and they should continue checking their sugar levels every 30 minutes during the exercise. Regularly checking the sugar levels during the exercise decreases the risk of hypoglycemia and potentially avoid the complications that might be associated with hypoglycemia. Whereas performance athletes like bodybuilders, they can see a rise in sugar levels because of their training. So they should be well counseled regarding the risk of hyperglycemia, and they should regularly check their sugar levels during exercise, and they should monitor their insulin levels and increase the insulin levels according to the sugar levels. And most importantly, they should consult a doctor or a physician prior to starting their exercise and starting their active sports lifestyle. That should avoid complications and help them go for a better life ahead in the sports and personal life. Thank you so much. This is for all. And for any diabetes related information, diabetes related treatment, you are most welcome at Udai Omni Hospital to consult us. Thank you so much.
Like and subscribe Eagle Health and Beauty.